Hi, my friends. Welcome to Euretina 2023. This conference is even bigger than we thought it would be. So many people here in beautiful Amsterdam. We're going to be talking with KOLs at the conference, as well as reviewing innovations on the show floor. It's probably the best Euretina ever. Be sure to check all of this out. Really, join us. But first, let's pop into a symposium. Sometimes I just want to check out new topics for me altogether. And so this talk on evidence-based treatments for CSC fits the bill. Dr. Sobha Sivaprasad mentioned how PDT can have poor treatment outcomes with CCSC, the chronic type, in patients with a poor baseline best-corrected visual acuity and other reasons. So in medicine, it's always important to remember to first do no harm. Back in the exhibition hall, I met up with an old pal on the Europe leg of the Bausch & Lomb World Tour demonstrating the C-Luma microscope. So I decided to keep following Florian Kaiser over to the Bausch & Lomb booth to check it out.
That's the roadshow we're doing. We are just want to show where we're going to show the microscope. So if somebody sees us somewhere on the Congress they're planning to go somewhere, that they definitely will be able to see our microscope. And and just behind the corner there's the baby, our new C-Luma system. And we are quite excited to go everywhere, and we get so much nice feedback from all the surgeons, and we just love to work with all of them.
The last stop on the C-Luma World Tour this year is at APVRS in Hong Kong. We'll be there to find out more. Meanwhile, I met Ramon Hilbrink first at ESCRS, then at Euretina, then I saw his product SurgiCube randomly at a clinic. I wanted to learn all about it.
So the SurgiCube is a standalone device that creates a, I would say, miniature operating room environment, so you can do your surgery in any regular room. I would trust a good surgeon to perform surgery on my children in this area. It's that clean. So we have the SurgiCube in several sizes, so it will fit the footprint of the room. And we have the smaller units, it's called the TOOL Meditech Operio, which is a standalone device, which we mostly promote in ophthalmology for IVT, intravitreal injection therapies. So within this area, up to 1.2 meters from the device, you will have the head of the patient here, and you can do the injections in a fully clean environment. And that's really cool. There's a capacity problem worldwide. We need more capacity to do the operations, to do the surgeries. There's many backlogs in many different countries. So adding capacity integrated in the ophthalmic department would definitely be a solution to that.
The clinic where I saw SurgiCube in action was Wellington Eye Clinic in Dublin, owned by the renowned Mr. Arthur Cummings. Speaking of top KOLs, Dr. Lilian Fu was on hand to find out more about new myopia implications from retinal experts, and to get her thoughts on Euretina.
I think it's a very well organized and very informative sessions where even non-retina surgeons like myself are able to get new knowledge about the updates in the latest issues in retina imaging, retina surgery, which can complement my daily practice. So some of the hot topics at Euretina includes the latest developments and updates in terms of retina imaging, such as OCT angiography, as well as pathologic myopia. At Euretina, we are concerned about the high myopic related complications, such as retinal detachment and retinal schisis. So the OCT imaging in the retina space can work in terms of various retinal conditions, which also includes myopia itself. So myopia has a choroidal neovascularization that can utilize OCT-A imaging in terms of the diagnosis and potentially in future the follow-up as well. And the progression as well as the increment in terms of the prevalence of myopia worldwide is really going to be a big issue.
But beyond science, I wanted to know what makes the Netherlands so successful, because as a country, it clearly is. Dr. Niels Kramer, a local who also is a professional orator on many topics including the Netherlands, had the answer.
Freedom of exploring your creativity. And I think there's a nice equilibrium between the structure and the freedom in the Netherlands, and I think that's why that happens. It's really cool because it's kind of a paradigm shift. I think that by putting those kind of inventions through, you create more flexibility. It's cheaper than building a complete new operating room. So there are a lot of advantages. What we've done in our clinic is just ask the patients who were just before they had surgery if they knew they were at risk for retinal detachment and if they knew what symptoms they should look for. And surprisingly, about 80% of the myopic patients did not know they were at risk for retinal detachment. For me, I like to get those messages from all the meetings together and take them as a host, take them to the audience. And whether that's on animation video or really at a stage or in front of a camera, it doesn't matter as long as we can get those messages out there.
I couldn't agree more with clearly communicating in eye care and beyond and innovating to do so. All in all, the posterior segment embodied in Euretina formed a powerful answer to the anterior segment's ESCRS meeting this year. Neither truly can be missed by the ophthalmologist or industry observer that wants the full picture. Next year, both meetings will be in Barcelona, a fairly short time apart, allowing an opportunity to attend each. With the amount of running one does in a single meeting, it's impossible to take it all in, but many exhibitors appear at ESCRS and Euretina to find at least a portion at the other. Similarly, crossover topics missed at ESCRS can be brushed up on at Euretina, so these really are sister shows, and it's worth visiting the whole family.
Well, that was a beautiful day at Euretina. So many innovations in imaging, as well as even small surgical suites. How cool! Time to get out of here on my local ride. See you later, guys. Doei!